Professor YACOUB KHALAF, welcome to Morocco.
أهلا وسهلا.
And welcome to the second annual Congress of MSERM.
Thank you.
Morocco is your second country. We are very pleased to have you here with us.
I am very pleased to be here too.
Could you just tell us the reason of your coming and what we are aiming to get as a result from this Congress, please?
The reason why I'm here is being part of the Moroccan Society for Endometriosis and Reproductive Medicine, and being closely associated with a great team that has been doing all the groundwork and collaborating with the rest of the world to bring together a group of experts from different parts of the world and local experts to cover important topics related to patients, whether they are associated with endometriosis or infertility and the latest development in assisted reproductive technology. This is something that I spend my life in, and it gives me great pleasure to be here sharing my thoughts and the experience in that field.
Yes, and you are a very much experienced person.
Thank you.
You are a renowned consultant, obstetrician, gynecologist, based in London.
Yeah.
You're also an international expert in infertility management and assisted conception, as well as an expert in the conservative management of uterine fibroids, right? You've been qualified in Egypt at the highly regarded Asyut University, completed your MD in Birmingham, so the list goes on.
Yes.
Maybe the most important question today is, do we have news regarding infertility treatment?
Infertility treatment is well established. It's not about what you do, it's about how you do it, how you make your decision, what consideration you take whilst you are treating your patients. Unfortunately, the desperation that goes with fertility management sometimes can be transcended from patient to their clinician. And this is where things go wrong, where a lot of interventions that don't add value are being used, and patient can be expected to pay for them. And this deprives the patient of the resilience, because if the patient spends their emotion and their money in the first attempt at ART, nothing is left for them. So my main message, whether it is here or anywhere in the world, is for clinicians to exercise the duty of care. Duty of care means to advise patients on what works and what add value, not what add to the bank account, not to what add to the bill that the patient has to foot. Because people have finite amount of money. If they are not used wisely, they will end up being kicked out of the race that is IVF, not because they don't have the biological material, but because they don't have the money. And that is an important message. Unfortunately, in our field, not many clinicians are discerning enough when they read the literature, when they hear lectures, to get what is relevant to their setting and to their patients and what is not. We have duty to our patients. First and foremost, that is the oath that we have taken, to do no harm.
Okay.
Yeah.
That's true.
Yeah.
So the message here is that treatment must be customized, personalized to each patient.
And only focus on what adds value, not because it has been seen on that television or on that newspaper. It is something that has been demonstrated on evidence-based ground that the patient will have value for the investment she will make.
And there's also a human message.
Yes, of course.
It
is important for all of us to put ourselves in the shoes of the patients, because if we assume that, we will know that it is frustrating to be trying without success. It is frustrating not to know what is the cause. It is frustrating not to have confidence and trust in our doctor that will do the best for us, not the best for other reasons.
Absolutely.
Yeah.
So I have a question, because we see many women who have been diagnosed with endometriosis, who think that infertility is their destiny, and that they won't be able to have children. And we've talked a lot about this Congress. I have the honor to be present to your presentation, and it was very rich. And there's a link between endometriosis and infertility, but can we give hope to these women?
Oh no, there are so many patients who have endometriosis who will go on to have very successful reproductive history where they could have many children, and we only know that they have endometriosis when they come after completing their family to have their tubes ligated. That is a fact. So presence of endometriosis does not necessarily mean presence of infertility. It could, but it does not have to be. So Unfortunately, when people hear the word endometriosis, they instigate a lot of surgical intervention that's not necessary. And some patients will need to have full investigation of their infertility and not to just be distracted by the red herring of endometriosis in some patients.
Yes, perfect.
Yeah.
I wanted to ask you, you're an international expert and you've had a lot of experience with patients suffering from infertility. What is the role of the psychological part in all of this? Do you have in your center, in your work environment, measures that have been put in place to accompany those couples who suffer from this?
Preparing the patient for treatment is essential.
Okay.
We all know that failing to plan is planning to fail.
Yes.
And that applies essentially to fertility patients, to any medical exercise really. Because some patients, all they need to know is assessment of the magnitude of the problem they are facing. When you see a patient who is 28 years of age, has been trying for a year, and she is having sleepless nights because it is not happening for a year, highlighting to her that her age is on her side, her egg reserve is on her side, the period is long for her, but biologically it is short. So for this patient, it's a matter of when, not if. Her chances of leaving the clinic with a baby are very high. Giving her that reassuring but truthful message is therapeutic.
Yes.
Equally, misleading a patient who lived it so long and came to see you when she was 45 that you will make miracles for her is misleading and cheating. You need to face her with the fact biology is biology. Exactly. If patients are serious about having children, they start as early as it is possible. Leaving it till 45, technology will do nothing.
Okay, perfect. So that's a great message to end with. We are very happy to have you with us.
I'm very happy to be with you.
This experience has been put into use and great use, and a lot of international experts have been
Thank you very much.
a lot of your recommendations.
Thank you.
Thank you very much for
very
being
much.
with us.
Thank you.
We hope we see you again.
I hope so
next
too.
Annual Congress, and welcome again to Morocco.
Thank you.
Thank
Thanks.
you.
Bye-bye.